recording. Perfect. Perfect. All right. Awesome. Hi, Callie. I can see you're on. I can't see anyone's pictures. Nice to see you here. Ah, I'm so excited to see you. Cool. We'll get started here in just a minute. If you guys want to drop into the chat where you're delivering and how many weeks you are, that'd be awesome. Or you don't have to, but would love to know where you're at least considering delivering. Would be cool. I know this is middle of the day. We had 40 people register for this workshop. So I'm going to see if a few more pop on. If not, we will send this recording out as well. But you are definitely doing yourself a favor by being here. And I am excited to teach you all about it. UW Midwives, awesome. Is it Northwest or main campus UW? Northwest. I love Northwest. I delivered my first 2 babies at Northwest. It was a great experience. First tell. Cool. Maybe it's Ama. I hope I can say I'm saying it right. Ama. Yeah, cool. Awesome. I'm excited for you. Northwest is just like great experience. I obviously haven't delivered at First Hill, but it was great. I wish I could have gone there for my third, but they were full. And I was hoping for a home birth and I had to transfer. And Northwest is always very full. So I transferred to Virginia Mason for my last birth. So, and I have a 3-month-old downstairs. I'm doing this from my mom's house so she can babysit. And she'll start daycare in January, which I'm definitely not ready for. So welcome everybody. We will get started here. I'm excited to be here teaching you guys today. First and second trimester here. So this is like such a perfect time to be getting this information. If you guys come on and want to share, if you weren't here in the beginning and you want to share or just want to share how many weeks you are and where you're delivering, I would love to see it. It's so fun to see that. Like I just said, I delivered my first 2 at Northwest, my last one at Virginia Mason, and those I highly recommend Northwest and Virginia Mason as well. The midwifery department there, it's brand new. And so everything is just like gorgeous there with these incredible views. So Virginia Mason is a really cool place to be too. So, all right, we will get started. Thank you for being here. This is being recorded. We'll cut that first part out. And when I answer questions, I'm going to try not to use your names directly back to you. And no one can see you're on or anything like that. So, but please like drop questions in the chat and I'll answer them as they come up for you. Or if you want to talk, I can definitely unmute you as well. But I am excited you're here. Thank you for being here. I'm still drinking my morning coffee, even though it's 11 o'clock, because that is the life of a new mom, I suppose. And it's definitely cold, but that's okay. So this workshop is all about pregnancy and birth prep and everything you need to know to prepare your body for birth. So thank you for being here. I'm the owner, Body Motion Physical Therapy. I'm Dr. Allison Felt, and we'll get started. So you see Isabel, she's on here too, and Devin is on here as well. And then Dr. Victoria and Dr. Riley are the other pelvic expert physical therapists at our clinic. And they are the ones treating right now as I'm on maternity leave. So, and they're absolutely wonderful. And we all treat with the same exact protocols. So you can't go wrong seeing them. Like I said, I own Body Motion. We are located in downtown Edmonds. It's an absolutely beautiful little area. And we are currently in the process of moving the clinic. So We will be in a new space as of tomorrow. So it's a little bit hectic down at the office today, but absolutely wonderful. And I just lost my chat box. I'm just going to make sure I have it back. Perfect. Yes, we're still in Edmonds. We're in the exact same building. We're just upstairs. So now we have these magnificent water and mountain views. So still in Edmonds. I would not leave it because that's where the magic happened. That is body motion physical therapy. So if you haven't been to the clinic, you'll definitely want to come to the new clinic. It's just absolutely beautiful. It's more space. And like I said, these views are to die for. And we'll also have an open house coming up at some point too. And then just so you know, for being here, and we offer everybody a 30-minute discovery visit in order to really talk about where you're at in your pregnancy. So whether you're 6 weeks, 12 weeks, or further on, and kind of we like to know where you're delivering and kind of what your game plan is for your specific birth. And pregnancy are obviously, they're so specific to you as an individual that nothing is like, you might have a friend that's pregnant, but they might be experiencing something completely different as you. So we like to do a free consultation to really find out where exactly you're at and then what exactly you're hoping for. And I highly recommend it. You're here today because you obviously care about making your birth and pregnancy easier for you. You're taking care of your health, and doing the stuff that we talk about today is going to absolutely make it easier. There's nothing easy about delivering a baby, but there is so much that you can do to make it easier on your body and to really protect your body for the future. So definitely get started with a 30-minute discovery visit. I recommend this to everybody. And if you're not in our area, but you're on here today, we'll definitely still give you one. And we'd love to see you for that. We have people that travel all over. Yakima right now is our furthest patient. Oh, we just had someone from Alaska to come and just to like get a dose of some PT and really prep their pelvic floor in order to deliver. And it is such a game changer to do that. So we'll talk about it as we go through this presentation. I'm going to start with just like a little story so you know pretty much what our patients are saying, because it's incredible. I'm going to talk about someone who was a second-time mom. She had her second baby over this summer. She delivered right before me, and she was a patient of Dr. Riley's. And she had been coming through her entire pregnancy, pretty much because she had a prolapse from her first pregnancy from pushing for hours on end. It was just a really hard labor, and she was going to have a C-section. And so she didn't want to go through that again. She wanted to protect her prolapse and really heal that prolapse and protect her body during pregnancy. And she was able to, during labor, she had wanted an epidural all along. So she decided to go that route. And she did our techniques through the night that she even was on the epidural, and she was breathing and doing everything well. And she felt pressure, like she was ready to push, and she vomited and her baby just came out on the table. So that's one of our favorite stories. And it's because she didn't even have to push and the baby just came out. Another first-time mom story that I'm going to just talk about is a mom went into labor, her water broke, and I think she labored for about 6 hours, and the nurses told her to push and to like her practice push, and the baby just came. And so she really didn't even have to push. She took a couple deep breaths and did the techniques that we teach, and the baby just came out. So these are the kind of stories that we hear when you prep your pelvic floor for birth. And I will tell you that not a lot of physical therapists, really hardly any pelvic PTs actually will do the techniques that we do during pregnancy for birth. So even if you're not going to come to see us, I will at least give you what should be happening in order to really help you protect your pelvic floor and prepare your pelvic floor for birth. There's a lot of people that still teach Kegels as a preparation method for birth. Your OB and your midwife might even say that that's how you prepare for delivering a child out of your vagina. But we know that that doesn't do it. That's not going to help. And if anything, that might make things tighter. And so my passion for this, I'll switch slides here and give you an outline of what we'll talk about. But really my passion for labor and birth and pregnancy really stemmed from seeing so many moms just struggle to have their babies. I mean, they're pretty much every mom I was seeing was pushing for, at least 2 hours, maybe 3, maybe if they were a second time mom, they maybe were only pushing for 2 hours, but it just seems so ridiculous that these push times. And I've met people that push for 8 hours, and I don't know, sometimes doctors, I guess, let you go that long. But it's fairly rare. And there's so much that we can do during pregnancy, that when you really take the time during your pregnancy to prepare your pelvic floor and bring it to the place it needs to be, your recovery postpartum is significantly different. And a lot of times when we evaluate people after they've had a baby and they've gone through the whole birth prep protocol, we can't even tell they've had a baby at their 6-week mark because their pelvic floor is in such good shape. So that's my little tidbit about like why this is absolutely miraculously important. And I'll do one more thing. I just have to share because it's that important. It's kind of like if you're like a very heavy duty athlete, say you're, in the NFL and you're playing and you tear a hamstring, you might be out for only like 6 to 8 weeks. And maybe less, if depending on how bad the tear is. But that 6 to 8 weeks, if you're an adult, a random unathletic person who tears a hamstring and that muscle is not conditioned, that can be a 6-month, recovery. And it's because the health of the tissue isn't like an elite athlete. So the same thing goes for the pelvic floor. If you don't prep your pelvic floor, you don't have the blood flow, you don't have the good coordination. So it's like if you tear during delivery, which everyone has micro tears in their pelvis, it's small little tears from the overstretching of pushing a baby out. And so when you have that happen and it's not a healthy tissue that's gone to those lengths before, it's so much harder to recover. So we try to say, like, we prepare your pelvic floor like you're an athlete. So we'll talk about that too. All right, so let's get started here. I'll talk about the anatomy. So anatomical changes that happen during pregnancy. Then we're going to talk about the core. Or first I'll talk about posture and the core and some body mechanic techniques just to help prevent things like diastasis, which is the separation of the abdominal wall. And then how you need to keep your core strong during pregnancy. And then we'll talk about the pelvic floor preparation for birth. And we'll talk about we'll give you some rituals on how to prepare for birth and really what you should be doing daily to coordinate your pelvic floor and keep your pelvic floor healthy. Then we'll just talk about some normal postpartum healing times. And please, I lost the chat again, but please, let's see here. Put in the chat if you have questions or if there's something specific that you want me to touch on. And I'd be happy to do that. Thank you for asking about insurance. I'm back to the chat. We don't accept insurance. We only work with insurance on an out-of-network basis. Pretty much anything for birth prep is not going to be covered. You can submit to your insurance though. And we do put codes on there that are typically covered. So if you have out-of-network benefits, we will always give you a bill and you can submit that to your provider. And most people do see some form of reimbursement. So and we have lists, and you can talk to Devin and Isabel about that too. So thank you for asking that. Perfect. Okay, so let's talk about some general posture stuff. So just as your body changes, I'm just going to show you here. So I'm going to go over here. So typically as your body changes during pregnancy, your shoulders are going to become hunched. Your belly is going to get bigger. So you're going to either turn into like an anterior tilt, or you're going to kind of sway back and your belly is just going to be here and your toes might flare out. So instead of that, I'll teach you some things to correct that, but also you want to be careful of your head that goes forward when you're pregnant. And this has been a big thing for me my previous pregnancy. And also when your pelvis goes forward, your knees tend to hyperextend, and that is really hard on the joints. And that's going to cause a ton of knee pain during pregnancy. So you want to prevent that hyperextension in your knees or locking in your knees. So it's important to keep your knees soft and slightly bent. And if you do this technique at the belly, that will help that. So if you've heard of the transverse abdominis muscle, that's a muscle that is part of the core, and I'll show you a picture of it, but it pretty much goes it wraps around your body here. And as you grow, it expands significantly. So that's a muscle that you want to keep getting stronger throughout the entire pregnancy. So if you grow a little bit, it's going to get weaker, and you just have to keep that muscle coordinated and pulling in. So this is like one of the most important core muscles besides your pelvic floor. So one way to contract that is, and you can use it in your posture correction, you should use it in your posture correction, is if you imagine, so here's my pubic bone, here's my belly button. If you imagine kind of lifting up your pubic bone towards your belly button, so I'm not sucking in and pulling my chest up, but I'm just lifting pubic bone to belly button. And so it makes my pelvis do, it can make my pelvis do a little tuck here. And so I hope you can see that on the screen, but as I contract that, I'm just tucking my pelvis just a little, but I'm keeping my buttocks relaxed. And that's going to be really important as you're walking around as your baby is growing. You don't want to be squeezing your butt, because that's going to make your pelvic floor much, much tighter. So anytime you're standing and just hanging out, you want to make sure that your butt is completely relaxed. You can think about like just relaxing your butt, and I'll give you some tips for that in a bit. But that's the number one thing. So posture, standing or seated, you want to always think about keeping that baby kind of pulled in. And that's an exercise. You don't want to be contracted like 99% of the time. You just want to be able to attain that posture, and you want your body to be in that posture. Because if you're here and your head is forward, it's just going to be a lot more strenuous on your neck, your low back. You might get numbness and tingling in your hands. You might get to just feel achy in your neck. It might make it harder for you to sleep. You might feel it more in your SI joints. So that's kind of in your low back there. So one thing you want to do is just pull that baby in and keep your pelvis not totally tucked, but slightly tucked, and your butt cheeks relaxed. And that's going to also prevent the knees from hyperextending. So, oh, I'm so glad Dr. Riley taught you that. Perfect. Thank you for sharing. And just when you know, if anyone has questions on that, on the posture, please let me know. From a forward head perspective, I kind of breezed over that, but you want to think, if your head is here forward, you want to pull your head back as if you're pulling like a ponytail up to the sky from the back of your head. So your neck kind of comes back. It's less attractive. You kind of like, people don't like to do that. I hate to do that because it looks like you kind of have a double chin, but who cares when it's like the course of your neck. So just kind of practicing that through the day. The other tip for posture is just keeping your shoulders down and back. So imagining if one shoulder blade is dropping down to the back pocket of your jeans on the other side, and then same thing with the other shoulder blade, it's just dropping down to the opposite back pocket. Just kind of keeping your shoulder blades down and back, and keeping your head over your body, and keeping your belly tucked. So hopefully that makes sense. That's the posture correction that we like as you're out and about and doing your daily things. If you just kind of check in with your posture, you don't want to be obsessive about it, but maybe if you're struggling with it, which everyone is, it's a hard thing to do, just check in with yourself, make yourself set a timer to check in, or just make that kind of an exercise that you do maybe at your desk. And that can really help your core. And the reason that helps your core is because it's all connected. And I'll show you that picture here in just a second. Cool. So before we go to pictures, just a little bit more about how your body changes. So as the belly gets bigger, baby is growing, the muscles are lengthening. This puts them at more of a weakness. So we call that a disadvantage. So as the muscles get longer, they get weaker. And so they're less supportive. So that's why it's really important to keep those muscles contracting, to do that transverse abdominis contraction, to keep the muscles supporting your body. One thing that gets weaker during pregnancy is your diaphragm. And so the diaphragm, let's see, I'm just going to give you a boob shot here. The diaphragm lives underneath your ribs. And so as the baby is growing in your belly, your diaphragms are going to, your ribs are going to start to expand. Your rib cage expands and kind of comes up. When that happens, the diaphragm, that's the very top piece of the core. It's a really important piece of the core. As that happens, the diaphragm kind of lengthens like this, and that diaphragm gets weaker too. You also will notice that it's harder to breathe. You might feel more shortness of breath easier. And that's just because you don't have as much space in your belly. And so one of the most important things that we teach is breathing, and really breathing is the essence of how to push your baby out, and is how we use it. And so when you take a deep breath into your belly, so I'm going to have everybody put your hands on your stomach here. Just messing with how close this is, hopefully. There we go. Okay, so if you put one hand on your chest and one on your belly, and you don't let your chest move, and you're just going to pull the air into your hand on your belly. So take a deep breath and let it go. Good. Inhale into your belly and let it go. Good. So that is a diaphragmatic breath. And our goal is to really just fill up the belly. You don't even have to just keep the air here. You can also think about bringing it into the ribs. And you can play around with where the air goes. But when you start working with a pelvic expert physical therapist, we really start talking about not just pulling the air into the belly, but pulling it down into the pelvic floor. So with every inhale, your anus, your vagina, everything opens in order to help. Like, that's the normal position the pelvic floor should be doing. So every inhale, so breathing in, pelvic floor is opening, and then there's space for baby to come out. So that's how we teach opening of the pelvic floor. And so what we find though is that sometimes people, if you're highly athletic, or you're a CrossFitter, or you're just really hyper flexible, those tend to be really, really tight pelvic floors, and they might not respond naturally to your breathing, your deep breath. So if you take a deep breath into your belly and you don't feel your pelvic floor, and you can't feel your vagina opening when you inhale, then that's like your sign, like, yes, definitely get pelvic floor PT. I'll tell you more signs in just a little bit, but absolutely, like, that you need to start to be able to coordinate your breath to your pelvic floor in order to push a baby out of your body. So I wish someone would have told me that in my first pregnancy. But regardless, that is like kind of the golden ticket. You need those to coordinate. Devin is do you mind pulling up that pelvic floor for me? So Devin's up here in the corner of my screen. She might be anywhere on your screen, where around my face. But here is the pelvis. And so the pelvic floor is the bottom piece of that, but we'll go through that in a second. You'll see the pelvic floor there. So at the very top, Devin, can you point to the pubic bone? This is your anatomy challenge. So right there, beautiful, right there. Yay. So that pubic bone, sometimes people will experience pubic bone pain during pregnancy. And what happens with the pubic bone is, the reason they're getting pain there is because you naturally get 5 to 7 millimeters of separation at that point. Oh, you can't see her. You can't see the pelvic floor. Oh no. Uh-oh. Okay. I'm not going to know how to fix that. Let's see my pictures. They're kind of far away. Okay. If I unmute you, ask to unmute. Cool.
Hello.
Hi. Can you see it? Yes, you can see. Perfect.
Yay.
Thank you so much.
Thanks, guys.
Letting us know. Okay, I'm going back to the pelvic changes. Perfect. Okay. So here you have, can you point to the pubic symphysis again? Perfect. So right there, it's a little piece of cartilage between the bones. And as your body changes, this actually happens like the minute relaxin is goes into your body, and relaxin is the thing that creates all the joint looseness in order for the baby to grow and your body to open up more. And that happens at like 6 to 12 weeks. So people can start experiencing all that stuff like right now.
So you guys can see it now?
Oh, they can only see when you're talking. Okay, so talk. Can you say where the pubic symphysis is?
Yes. So here is the pubic symphysis, guys, and that's where you'll have that separation and feel that pain really early on in your pregnancy.
Possibly early on. And Devin, then you're going to get to do the pelvic floor tour when we come back to you. Awesome. Thank you so much for your help in telling us where things are. Great. So the pelvis is changing that much, and that is why sometimes it gets painful in that area. Now, the pelvic floor should naturally, is what people say, should elongate and as you become more pregnant. So throughout your pregnancy, people assume that you get this pelvic floor elongation, and that's going to help the baby come through the birth canal. What we see is that's not true. With the tightness, with our daily lives and exercise and activity, our high stress lives, most people that are pregnant will experiencing a tightening of the pelvic floor. And that's because your body is tightening in order to secure the ligaments together, try to keep the joints tight to prevent you from having pain. It's common. Devin, can you show the SI joints as well? So turn the pelvis around, and then can you talk while you show them?
Can you hear me? Here are the SI joints, right? They connect to the hip bones. Oh, look at me. I've been working here a while.
Beautiful. Thank you so much. So it's common to get pain in those SI joints as well. And again, your body's reaction is oftentimes to tighten the pelvic floor. And so although that is I love the cheerleaders. Thank you. Although that is, we don't want that to happen, right? So the whole point of like when you're pregnant, you want that pelvic floor to open up because we got to start preparing this baby to come through the birth canal. And so we're going to talk about how to do that other than just using your breath. But so anyways, that's the whole point of the pelvic floor is the baby's going to come through that birth canal, and it is through the vagina. And I have more pictures to come, so we'll talk about that. The other core muscles that get stretched out and get weaker are your obliques. So those are at the side of the belly right here. And then you have your rectus abdominis, so your six-pack ab muscles. And then you have that transverse abdominis that I was talking about earlier. I'll show you some pictures here in a minute. Again, the relaxin in your body is what's going to make those joints a lot looser. So you just don't have as much natural stability. So you might not feel as good running. Maybe you're an avid runner or an avid CrossFitter, but you're just a little bit more susceptible to injury because of that instability in those joints. So that would be a time where it's really important to work with a pelvic expert PT to make sure that you're stable enough to keep doing the exercises that you love. But it also is just something that might be why you want to modify. Perfect. Definitely got injured because I felt so stretchy, but wasn't actually. Yeah. And so people love doing yoga during pregnancy. It's like a whole thing, like prenatal yoga, right? But if you're not activating your core when you're doing yoga poses, then it could absolutely be more detrimental because you're pushing into your joint flexibility versus your muscle flexibility. So yoga is most effective when you're stretching your muscles, and safest when you're stretching your muscles. But when you start to stretch the actual joints is when things get pretty dangerous. So it's important if you just do that TA activation, so that transverse abdominis contraction during a lot of your yoga poses, and even pulling the shoulders down and back while you're doing your yoga poses, that can help protect your body a lot. But I'm sorry to hear that because that's not fun. Okay, so like we just talked about, muscles become weak as the baby grows. So some of the things that you want to start to modify are these postures here. I'm going to go a little out of order because I'm sitting here. So I'm just going to show you from my chair. So as you're sitting here, you want to make sure that your knees are fist width apart. And that will ensure that you're sitting on your sit bones. You don't want to be slouched over and you don't want to be arched forward. You really want to be in what we call a neutral spine. So if you're sitting with your feet fist width apart, not crossing your legs, that's going to be safest for your SI joints and your low back. And I know like it's so common to like just want to cross your feet or cross your legs, but that is a habit that you will want to break because the relaxin in your body is making you so much more looser that will it's just going to predispose you to having more SI pain or pubic bone pain the more that you're shifted on one side versus the other, which is what's happening when you're crossing legs. So as far as sitting postures, fist width apart in the knees. Same thing with standing, fist width apart between the feet and the knees. It's going to depend on how much girth there is on your body. That will change. So my legs touch, so I just go by my feet. And having 2 fist widths between my feet is what's easiest for me. We went over the standing postures. So, and we're going to go over seated toilet postures in a couple slides here. But then getting in and out of a car. So in order to get in and out of a car safely and protect your body safely, I say start adapting this at the beginning of your pregnancy. So even if you're not showing, you want to make these adaptations right away or as soon as you see this. And the reason is you just, when you like naturally, when we get in the car and we just like swing one leg in and we put all of our force on one leg, that can shear the pubic bone. And so in order to really protect your pubic bone, we teach that so if this is my car, I'm going to sit my butt down first in the car. And then I'm going to bring one foot in and the other foot in, trying to keep my legs as close together as possible, just to really protect the pubic bone as much as possible. The minute you start to feel any pubic bone pain, you have to get in to see a pelvic expert PT, or this thing is going to persist your entire pregnancy. Or it still might persist your entire pregnancy, even if you're seeing a pelvic expert PT, but you can make it a lot less painful by getting in and having a lot less of a negative result at the end. If you have this, you're probably Googling it, and the stories are never pretty. So definitely do a consultation, meet with somebody to really figure out what's going to help your body. Felt pain in the pubic bone, or is that what you're talking about, Elise? In the pubic bone when you vacuum, or just in the pelvis in general? And that is a hard, in the pubic bone. Yeah, it's just it's a hard exercise. What you can, if you have to be the vacuumer right now, I definitely recommend trying to do that TA. So pulling your pubic bone up to your belly button in order to really secure your pelvis while you're vacuuming. But because it's a one-sided exercise, it's hard to keep everything stable. So yeah, but definitely get in and talk to a pelvic expert PT. We'd love to help you if you're not already working with us. And then a couple things, sleeping postures. So sleeping postures, you'll want to have, I like to say, a towel roll under your neck. The goal of sleeping, so either mostly on your side, because you're pretty much going to start adapting that as you start to show, they say second trimester. The research, you want to sleep on your side pretty much. And really the research about like the decreased blood flow to the baby, what we do know is like exercising and holding your breath. They call it the Valsalva. So exercising on your back, starting at not till 38 weeks is actually what affects blood flow to baby, but you want to be cautious anyways throughout your entire pregnancy. And usually your body will wake you up if you are on your back. Nonetheless, you definitely, like we just always say, like be on your side during your pregnancy for sleeping. And so to keep your body as in good alignment as possible, that is the goal when you're sleeping, which is really hard when you're pregnant, because that can be really uncomfortable, whether it's your hip bone, like right on your hip, or whether it's your shoulder or your hands are numb. That was my big thing this past pregnancy, was the hand numbness. So the first thing that we recommend is have a pillow that keeps your head neutral in this position. Imagine I'm here, but on my side. Okay. And so you don't want to be cocked up and you don't want to be like crunched down. In order to attain that, we recommend rolling up a little towel roll and just sticking that right between the neck here. And you're lying on that. That might have to be, it's going to be different for everybody's body. That might have to be on a pillow or not. But towel roll there to support the neck. And then we say a towel, either a pregnancy pillow or a long pillow between the knees and between the arms. So your whole body just stays in that nice alignment. Also tucking something underneath the belly while you're on that side is really nice, because the belly, if it's flopping down to the table or to the bed, it will pull your spine in that rotation. And so you'll be sleeping kind of in a spinal rotation all night. And if you're sleeping in that position, it's just going to because of the relaxin, it's going to predispose your spine to having more injury, or susceptible to more injury or pain during when you wake up, or through the night. So you just want to be as aligned as possible so your whole body is supported. As far as pregnancy pillows, people love to talk about how good pregnancy pillows are. I think, and you might have your favorites, and I don't want to change your mind, but the simplest ones are actually the best ones. So just like your standard square body pillows that you can just sleep with. The ones that like wrap around your neck and your head, those just get a little dicey, because if you're putting something like that underneath your head, it could cock you up like in a very unsafe position, because those tend to be pretty dense. So if you do have a pillow that's really fancy and cool like that, just flip it around so the U part is on your butt, or like between your legs that way, and not on the U under your head. But you can make any pillow that you already have work for you. It's just all about keeping that spinal alignment. And they have fancy pregnancy wedges for the belly, but I'm just all about the towel rolls. So just like fold up some towels and stick it under there, or you can buy a fancy wedge if you want to do that too. What's your recommendation for exercise to prepare for pregnancy while in the preconception period? Okay, so while in preconception, I think that you should exercise. There's a lot of people that speak exactly to this, and you can come work with us specifically and we can program for you, but pregnancy programs are safe for you throughout pregnancy. So why not start them in preconception? You can go a little bit harder in preconception if you want to. But really, as long as you're doing a good exercise program, that is awesome. Now, the reason I'm like stumbling over this is because it's a complicated matter there's a lot of research, not a lot of research. There's a lot of programs that people tout as like, do this during this phase of your cycle. You're doing this during ovulation, this during possible implantation. And like, there's just there's a lot, and that can be confusing. So, and if you want to like break down your cycle like that and exercise a certain way during your cycle, you can, but I say like go for a pregnancy program. There's Pronatal Support has they do pregnancy classes. So they're a good one. There's a couple other recommendations that we can give you throughout if you want to contact us directly, and we can give you that are safe for during the preconception time. I would say the most important thing preconception wise is to get your transverse abdominis strengthening as much as you can. So you want to keep your coordination with your transverse abdominis, and then you want to train your pelvic floor. So, and it's not through Kegels. You want to train your pelvic floor to open up and really have that motion. Oh, perfect. Good. Okay. Well, maybe I can chat with Riley. We can talk about your programming if you're interested in doing cyclical preconception stuff. Cool. Okay. I'm going back to the sleep. So we just finished sleeping postures. If anyone has questions on that, please throw it in the chat. And then the last thing I'm going to actually demonstrate here on the bed. So if you see the bed here, so getting in and out of the bed. Okay. When you get in the bed, you're going to sit down and go to your side like that. Oh, maybe if I go this way to the side, you can see me here. This is such an awkward angle. But you're here, and then you can roll to your back or roll to the other side. But you don't want to just, what people often will do when they're pregnant is when they're getting out of bed, especially, they'll come up and kind of push their body up like they're doing a crunch. That's going to really put you at risk for a separation here, which is called a diastasis recti. And so to prevent that, you want to go to your side, and same thing, rolling out of bed. You want to roll out of bed to your side. Does that make sense? Hopefully. I will also warn you that if you have like a recliner or even on the couch, especially throughout, like as you get bigger in your pregnancy, you're going to want to, so you're not like leaning back so far. When you come out of that and you just crunch up, even though it's such a simple movement, that's where we see people like give themselves a diastasis. So give themselves a separation. A way to correct that, if you still want to do that crunching movement, is make sure before you do that, make sure that you engage that transverse abdominis. So you pull it in, and then as you come up, you exhale. So you're blowing the pressure off, but it's still a dicey thing to do. And I would recommend that, like, when you're reclining at all, just like go to your side or use your arm just a little bit to help protect that abdominal wall. Hopefully that is helpful. Push yourself up that way. Yes. Yes, definitely roll to your side and then push yourself up. That's what I'm trying to like show you here. Our online birth prep program, if you, which is like on major sale for anyone who attends this and registered for this, it has like these breakdowns of these exact videos too. Or you can come in for it, discovery visit, and we can break this stuff down for you too. Cool. Okay, so now we're going to the importance of the pelvic floor. So Devin, will you bust out the pelvis?
Hello.
Hi. You have to talk. So
Here is the pelvis, y'all. Can you see me yet?
I can see you, but I mean, I've been able to see you the whole time. So go through the other way. Show us through the sit bones. Perfect.
All right, here are the sit bones, y'all.
So we have anus, vagina, urethra, and clitoris. Could you
Okay,
put
so
those out?
anus, vagina, urethra, and your clitoris is right there.
That yellow dot is the clitoris. So goal throughout your pregnancy is to get this pelvic floor so dynamic and mobile that the baby is just going to come out of your body. Okay. So that this pelvic floor can stretch so much that the baby is going to come through that vagina. Will you be able to pin Devin so she doesn't go away? Ooh, can I pin you? Yes. Thank you so much, Sonia. I so appreciate that.
You guys are awesome.
Yes. Definitely have people that work in tech or something. We're not that savvy, but this is cool. Okay, cool. So yes. So the goal of pregnancy is to help open up this vagina. And it's hard to do that, like I said earlier, when your relaxin is happening in your body. Also progesterone. These create instability and will make your joints loose. So the pelvic floor naturally wants to tighten and make things which is not healthy for prepping for delivery, but it's healthy in order to protect your joints. So this is where we have the body working against each other a little bit. And so the cool thing here is, so far we're looking at vagina. Can you show clitoris again? That yellow dot is clitoris. Perfect. And you can kind of see how those muscles like wrap down towards the vagina. So we're going to talk about on the next slide why orgasm is really important during pregnancy. In order to help prepare your pelvic floor. But also, still can't see Devin without talking. You are pinned.
I tried to pin myself, but I don't know if it works. So hopefully you guys can see me. So this yellow dot up here is the clitoris. There is the urethra, there's the vagina, and then all these muscles kind of wrap together downward. And then there's your anus.
Perfect. Thanks, Devin. I think that might be all we need for the pelvic floor.
Cool.
But pelvic floor is 3 layers of muscles. So that's also important to know, and we'll talk about that in a minute. So pretty much, if you can visualize with me here, if you think about having a bowl in the middle, pretty much your vagina is in the middle of this bowl. Okay. So let's imagine that here's a bowl. It's sitting inside your pelvis and there's some holes in there. So every time you breathe into your belly, so here we go. You're doing that diaphragmatic breathing for 5 minutes a day. So inhale into your belly. You want to think about your anus and your vagina opening as you do that. Maybe if I stand up and have this funny angle, but here we go. So breath into belly. And as that's happening, anus and vagina are opening. So your pelvic floor is also opening. Okay. So we're using that breath and you're tying it to your pelvic floor by thinking about opening your vagina and opening your anus. Like I said, if you can't connect to those, that would be like, you definitely need to see a pelvic expert PT to get that connection. So we can work on those muscles directly so they will move and open when you have those deep breaths. So that's my breathing and lengthening. So you want to breathe 5 minutes a day at least as a preparation for birth. This FlexX, Devin, we're going to have to send you a video so you can see this preparation activity, but this is like a foam roller for your vagina. And we will, do you have one by you? Devin's going to demonstrate this exercise. I'm so sorry.
Great. Okay, y'all. So this is the FlexX, and it's kind of just a. Can y'all see me? So you'll want to do this on a chair that's harder, but you essentially just put it right where your sit bones are, and then you'll lean forward for a few minutes, really breathe deep into your pelvic floor, and then you'll kind of lean back. And then I think you can even do it to the sides, right, Allison? And really just like release all those muscles that are right in here and kind of relieve the pressure on the sit bones, right?
Yep.
Cool.
So you can use a pool noodle for this. And you can start doing this at any point during your pregnancy, but this is going to help those superficial muscles. So the very first layer of your pelvic floor open up. And yes, so hopefully, oh, good. You saw that. I think you saw that FlexX demonstration. So we call that the FlexX. So a couple of things you're going home with today: doing your transverse abdominis, doing the breathing and pelvic floor opening, and then you can get a pool noodle. They're like $1 at the dollar store, or we sell them in the clinic as well. And you do that release technique. It's exactly like a foam roller for the vagina. And then the only time that we ever really teach Kegels, and really the only time you should be doing Kegels, is with an activity. So you don't need to just do reps of Kegels. Now, I will tell you that many other pelvic floor PTs will say you need to do 10 long hold Kegels a day and 5 short hold Kegels a day. I'm sorry, 5-second, like shorter Kegels, 5-second hold, and 2-second hold Kegels a day. So if you like hold 2 seconds 10 times, hold 5 seconds 10 times, hold 10 seconds 10 times. Okay. So those kind of Kegel exercises. And just from clinical practice and what I've seen over my years of working with pregnant people and women is that doing those kinds of repetitions for like birth preparation has absolutely zero improvement or effect on the birthing process, and maybe even might be detrimental. However, that is what the research says, and it's old research, but that's really what most people and practitioners are going to go by. And so if you have a pelvic floor PT that's telling you to do Kegels to prepare for birth, or hooking you up to a biofeedback, which is like these little electrodes that go by your anus in order to prepare your pelvic floor for birth, I'm going to tell you that that's like archaic. And I've never seen that help in the birthing process. And I've been a PT for a long time. And really what makes the biggest difference is stretching your pelvic floor and opening your pelvic floor and coordinating your pelvic floor with breath. So that is like the best thing I can tell you. So the only time to really do a Kegel is like, say, if you're lifting a baby or a kid, or you're lifting something heavy, it would be to coordinate your breath in a Kegel with that kind of movement. But we don't ever teach Kegels just as a birth preparation or something to do during pregnancy, because like I said, your pelvic floor is already tighter during pregnancy. And with that, if you're strengthening a really tight pelvic floor and you're just squeezing it here, it's just going to get tighter. It's not going to get stronger. Most people have problem opening their pelvic floor and lengthening their pelvic floor. And again, this is just clinical practice. This is what we've developed at Body Motion, and really what we stand by, and why our C-section rates are so low. So that is, this is like, I want to debunk all this because this is very common in physical therapy settings or in any birth preparation settings, programs, that they'll tell you to do Kegels. So we want to make sure that that is not how you're preparing for birth. And one other time it would be okay to Kegel. The only other times would be coughing and sneezing. And I'm just going to tell you one other thing: when you're thinking about doing Kegels, or someone's telling you to do Kegels during pregnancy, one of the things you really have to be aware of is that if your organs, so sometimes your organs will come down lower, your uterus, or that you'll see your bladder through the vaginal wall, or you'll see your rectum. That's called a prolapse. When you have any kind of prolapse or descent of your organs and they're below your pelvic floor, so here's pelvic floor, this is your third layer now. I'm going to say this is your third layer, and your organs are coming lower. If you're Kegling, that can actually squeeze your organs out, and so they're lower. And so that's why, again, another reason why like it's almost necessary, and it should be absolutely standard of practice to work with a pelvic PT that's going to help to make sure that you're not squeezing your organs out during your pregnancy, and you're really working on just like keeping things up and in, but also opening your pelvic floor. So I hope that makes sense. It's a little tricky to just describe. Oh, and then I just got a question. I'm going to read it to everybody. Is my opinion on sitting on a birthing ball during pregnancy, is it beneficial for pelvic floor health? I think it's just beneficial in general. I don't think it's going to impact the pelvic floor at all. You can sit on a ball or you can sit in a chair, and you can either have good posture or not good posture. It's not going to like, it doesn't necessarily affect like how you're sitting determines more of what your body's doing versus what you're sitting on. Now, if you're sitting on like a hard church pew, then that might not feel so good after a while. But other than that, a birthing ball is absolutely fine. I wouldn't say it's necessarily beneficial for your pelvic floor. If you were doing an exercise on a birth ball and you were doing your breathing and it helped tell your brain like, oh, I can really feel my pelvic floor on the birth ball, I can feel it opening, then that would be a good exercise to do. Hopefully that helps. Cool. Yes, and I will give, so recommendation for posture and engagement while walking. Yeah, so as far as that goes, I'm just going to preface this by saying you don't want to be like squeezing your pelvic floor your entire walk. You don't want to be squeezing your TA your entire walk. You want it to naturally be strong and kind of have a good tone to it. So when you're walking, I say like, you kind of, this also depends on where your pelvic organs are, surprisingly. That's why working with a PT is great. So you know if you have a prolapse or not, you can kind of shift your weight one way or another, and that will help things stay in your body a little bit differently. But when you're walking and just going on a walk, it's good to TA. So TA is engaged. So shoulders are down and back, TA is engaged. And especially during pregnancy, you want to make sure that you're pushing your toe off behind you. So you're like almost pushing the ground away from you. This is going to keep your glutes activated, and it's going to keep what we call your hip extension. So that's the ability of the leg to come behind the body. So just on your walk, you can, I would say, check in. Don't think about this your entire walk, because the walk can be so meditative and relaxing. But, a couple times during your walk, think about like, okay, is my TA engaged? Are my shoulders down and back? Like, how am I flowing through my walk? Are my muscles active? And then am I pushing my toe off behind my body? A lot of times you'll see people start to waddle during pregnancy, and that's just, they lose their hip extension, the ability of the leg to come behind the body. So they're not using their glutes. And then they kind of splay their feet open to give them a little bit more stability. So to keep, and that is just a FYI, I'm going on a tangent here, but that is a little bit about also why, like after pregnancy, you don't just jump back into running, is because not only are your organs still having to suck it back up into your body, but your hip doesn't come behind your body typically until about 6 months postpartum. So you don't really get hip extension back until 6 months postpartum. And so keeping that leg coming behind the body is really essential for not just your pregnancy, but your recovery postpartum. Cool. All right. So pelvic floor, we talked pelvic floor. I'm going to tell you, so this is, hopefully you can see my arrow, but you can see your transverse abdominis here. It's like this wrap around your body. And then you have a diaphragm here, which is that top muscle. Your pelvic floor is shown at the bottom here. And then there is some muscles on the back. And what those do is they create a canister, which is your core, and that core regulates the pressure. And so when we talk about having a strong core through your pregnancy, we want to keep all of these muscles strong. So that's why you're doing the breathing. So as you breathe, that diaphragm comes down and the pelvic floor goes down, and your transverse abdominis goes out. And then we talked about just doing the transverse abdominis contraction. So you're kind of pulling this muscle in and keeping pelvic floor relaxed. So, and then these are your SI joints down here, and those are oftentimes what can be painful. So there's a lot of techniques that we can do to help all that pain. And anytime you are having pain, you just want to make sure that you're seeing a pelvic expert PT to really help you open that pelvic floor. Again, like the reason, or like a huge reason why I think it's so important to see a pelvic expert PT that's going to not just like treat you externally, but also look inside your pelvic floor and treat inside your pelvic floor, is because that's what keeps the muscles strong. That's what keeps the core pressure strong. That's what keeps everything coordinated and able to open for your birth. I will tell you that this past birth I had was the first time. I've been a pelvic PT for a long time, over 10 years. And I had even during my first and second pregnancies, I was a pelvic floor PT, but I only had biofeedback and I was only getting treatment externally. And I will tell you the difference between pushing when you're getting treatment internally to really open up your third layers of pelvic floor is absolutely amazing. And I can't explain it other than if you have an evaluation, whoever you're seeing absolutely needs to be looking at all the layers of your pelvic floor and treating all the layers of your pelvic floor in order to allow that to open up. So I'll leave that there because I want to get to this before we end. So when we're talking about pushing baby out and why it's so important to have that open dynamic pelvic floor, and if you don't, which it's hard for pregnant people to do, you want to make sure that you're seeing someone that's going to help open that for you. And that's through internal treatment. And a lot of times people will ask me if they can do that themselves. And it's just really hard when you're pregnant, but we can teach you to do that yourselves. We don't teach using like any toys or wands while you're pregnant, simply because you don't know if you're touching your cervix or not. And everything we do will not ever touch the cervix when pregnant because you don't want to stimulate the cervix. So out of safety, we never say that. The other time it wouldn't be appropriate to do any internal work is if you're on pelvic rest or you're actively bleeding, which would mean that you're on pelvic rest as well. So that would be like your OB or your midwife would tell you that. But other than that, everybody is a candidate for pelvic floor PT during pregnancy. And so we're going to talk about how to have a healthy bowel movement, because this is going to prepare you to push your baby out. So this is dedication. So every time you get an urge to have a poop, this is the technique that you're going to want to use. Okay. So if you're sitting on your toilet, this is going to be my toilet, you can either put your feet up, but that might get harder as you get more pregnant. Or you just lean forward and you can put your arms on your legs. When you're here, you're going to take 3 of the diaphragmatic breaths that we talked about. So you'll do 1, you'll do 3. And when you're doing that, you're thinking about your pelvic floor is opening on the inhale. Okay. So you're inhaling into belly, anus is opening, vagina is opening. You exhale. It should be easy and natural. You're not forcing anything. And so you're doing 3 of these breaths. And on the third one, you're going to gently bear down. So this is not a push at all. This is a bear down. This is like you're trying to open your anus a little bit farther. So you're as if you're trying to fart, but you don't want anyone to see you fart. So it's like the smallest movement that you can imagine. So your bowel, your stool consistency might be soft enough that you don't even have to push. You can just breathe your poop out. And that's kind of how you want your poop to go. And if you have other kids, this is how you want to teach them how to poop, because this will help protect their pelvic floors as well. And so questions on pooping at all? This kind of movement is exactly how you would coordinate kind of pushing your baby out. It might take more force while you're delivering, but all of that mechanical stuff of expelling the baby from your body, you can talk through and look at your body specifically with a pelvic expert PT. And that's what I would recommend for sure. If you're dealing with constipation, it's something that you want to deal with right away. So talk to your midwife or talk to your OB. And you definitely want to Sorry, I got distracted by the questions. You definitely want to get the constipation under control. Some of the things that your OB or midwife would recommend could be magnesium, could be psyllium, but you kind of want to stay away from stimulants if possible. You really want to work on just like having that good dietary fiber, and or magnesium. So talk to your provider as to like get that under control, because the more stool and like the harder it is for your stool to come through, the more pressure that's going to put on your bladder, the more susceptible that's going to make you to having a prolapse. That's going to predispose you to having a prolapse. So even if you weren't pregnant, you'd want the constipation to be under control so you don't get any like pressure down on your organs. Do you just hang out for a long time till your breath works? No, you don't want to sit on the toilet forever and ever and ever, like a lot of people's partners do. You want to like, it should start working the more you practice and the better your stool consistency becomes. It should help. Okay, does the pushing technique change with prolapse? So if we're talking about, so that was just pooping. We haven't really talked pushing, but one of the things, I would say no. For pooping, yes. If you have a prolapse, you might not feel comfortable being forward like that. And maybe your bladder's in the way when you're in that position. So you might want to lean back. You might have to lean back to have a good bowel movement. So that's something to keep in mind for bowel movements. If we're talking pushing a baby out, a prolapse position shouldn't matter. Now, people like to say, like, don't deliver on your back. And I used to be one of those people, but I actually, and I was thinking about this a lot before I gave this talk today, because we've had so many patients over the last year who have had these amazing deliveries. And a lot of times, a lot of them have epidurals. 85% of people have epidurals. And that's nationwide. That's not just our stats. And a lot of times you end up delivering on your back. Maybe they'll get you onto your side a little bit, but most of the time, people will deliver on their back. And if their pelvic floor is dynamic enough, it actually shouldn't matter. And it doesn't mean that they're going to tear more or have more damage at all. And I think the same with a prolapse. Like, yes, if we have gravity helping, that might be good, but maybe for a prolapse, if you're on your side, it's not as bad. But I disagree with all of it. And I just say, like, if your pelvic floor is dynamic and open enough, then it won't actually matter like where you push the baby out, because your pelvic floor shouldn't have to strain a ton, and it shouldn't, like, the opening, your body should be used to the opening. So pretty much when we're treating and like preparing the body for birth, we're practicing getting the pelvic floor in that position on all the layers. So I'm going to go to the next slide here. So that kind of leads me here, is like how to prevent tearing and improve your push. And so what a lot of people will say, and the research does not actually support this, but like to prepare for birth, they'll say at 32 weeks, you can start doing perineal stretching, or thistles massage it's called. And that's like just stretching just the opening of the vagina. So that's like, if this is my vagina and I'm just stretching, so I might like hold and stretch just the opening, or I might rub that area. You might have a partner do it, because when you're 32 weeks pregnant, who can actually like reach that comfortably? It's hard. But what I think is most beneficial, and the reason I think the research doesn't reflect that perineal stretching helps you not tear, is because you're not addressing the whole pelvic floor. Now that's what we do at Body Motion, and you will not find that in most places, is like we really go through and so if this is my vagina, we're working in all these layers of the pelvic floor, so the baby can come through the birth canal with that much more ease, and not be stuck up high. You have some people, you'll hear stories all the time, and only listen to good stories when you're pregnant, but you'll really hear like, baby got stuck and I had to have a C-section and all that crud. So don't listen to that stuff. Just work on your pelvic floor, open your pelvic floor. And that can be like kind of the magic trick to not tearing, and also just getting this baby out so the baby doesn't get stuck. Cool. So that's what stretching and finding new lengths of the entire pelvic floor is. Oh, and there's a question here, so I'm going to go back to that. Oh, I already answered that, but I don't know how to change it. So I think there's only one. Oh, Okay, so we're going to talk orgasm really quick. I kind of mentioned this briefly, but those orgasm, so the clitoris is made up of the muscles that surround the vagina. And some people find it difficult to get an orgasm during their pregnancy. And I think this is because the muscles are changing so drastically. So to keep the muscles healthy, I love to say, like, yes, have an orgasm all the time. Give yourself orgasms, do it with a partner, whatever is most comfortable for you. But it's important that you continue to have orgasms because if you read the definition here of what an orgasm is, it's intense pleasure, but it also can create rhythmic contractions of the uterus. And so it's kind of like you get to teach the uterus a little bit how to contract. So I feel like it's almost like this free practice of uterine contractions that we get when you have an orgasm while pregnant. And so it's like you get to like teach the uterus like, hey, like this is what it'll be like when we like start to contract. And there is no evidence that says like orgasm causes preterm labor or cause anything like that. So totally safe, guys. But just good. I don't know enough about like the actual theory of orgasmic birth. Of course, I read about it when I was pregnant. I'm like, I want to have an orgasm while I have my baby. But yeah, I mean, I wanted that so bad, but I don't know enough like to like teach the theory of orgasmic birth or anything like that. And sometimes people say like stimulating your clitoris can help uterine contractions, of course, like we're just talking about during the actual birthing process. And if that's you, that's awesome. It wasn't me this time around, but that is what it is. So anyways, keep on orgasming, keep on breathing, and keep on contracting your bellies. That's kind of the take home. And it's also, we also like to say like finding a routine that works for you, that's safe. And a lot of times it needs to be pregnancy specific. But if it's not, then just work with a PT so you know that what you're doing at the gym is safe. There are certain things that are safe, that like bar 3 is great and can be really safe, but you just need to know how to modify it for your body and for your pelvis. And boot camps and CrossFit, that can all be fine and safe, especially if you were doing that beforehand. You just have to figure out how to modify that for your body. I talked a lot about the pelvic floor because no one else really does, so I just think it's like the absolute epicenter of how this baby comes out of your body. And being pregnant 3 times now, or having 3 babies, I've wanted nothing more than to have these babies just like float out of my body. And the first 2 times that didn't happen, I had to work really hard to really get the babies out. And it's such a different experience when your pelvic floor is like that much more open. And when we help patients with that, their experiences and their recoveries are just tenfold different when you're actually working on the interior of the pelvic floor and the pelvis. Now it's not just about the inside of the pelvis. It's all about, it's about your hips too, which can be addressed on the outside of the pelvis, but kind of making sure the muscles are flexible in those regions that are really hard to stretch is what it comes down to. And also are able to coordinate. So I hope that helps and makes sense. These are just some things that like, if you have this, most likely your pelvic floor is probably super tight. And that would be low back pain or upper back pain. Even neck pain is very relatable to what's happening in the pelvic floor. And any pubic pain, leaking of urine, achy muscles. And yeah, so that can all cause, like if you're experiencing that, most likely your pelvic floor is pretty tight and you'd want to work on opening it. And the other thing we can do is we can do some pregnancy programming for you as well. And our birth prep online program is a great way to get some of those exercises. They're not like a specific strength. I wouldn't say that. It's a lot of like the flexibility that we teach if you come in for a session. So how to keep your hips open, how to push, and all that good stuff. So we didn't go over like exact mechanics of pushing here, but we'd love to, teach you that and like specifically how to coordinate it with your own pelvic floor. So if you have any questions, drop them in the chat. I'll be here for a little bit. These are the references. Anything else I have on there? Nope. Perfect. Thank you so much for being here, guys. This was a ton of fun. And we will send out replays. So Feel free to book a discovery visit. Devin, you want to drop that in the chat? Cool. Thanks for being here, Kat. Awesome. Thank you, guys. When will I be back in the office? I'm going to be back for 2 days in December, over the Christmas holiday. But Riley and Victoria are absolutely amazing. You will love them too. In January. Awesome. Good luck. I think it's Raylene. Good luck to you. That's exciting. Thank you, guys. I'm super excited for all these babies. And mine's waiting for me downstairs. Hopefully sleeping, not screaming, so that's great. Cool. I'm going to close out of here. Maybe.